because Cuban researchers at the Finley Vaccine Institute now expect that one of these candidates will enter phase 3 trials in early 2021 and be available during the year for the Cuban population. More again in that interview with Dagmar Garcia coming up in MEDICC Review. Number 9, what is the next phase? Number 9 lesson for the world. Well, they're moving toward a new normal, but again, it's phased, geographically determined recovery because all has not been rosy in Cuba. Following an uptick in cases in late summer, the capital went into lockdown for the full month of September, rolling back its recovery status, mainly due to people not abiding by health and safety precautions, especially younger people. At least one other province also was bumped back into a more restrictive recovery phase. But later, with positive results by this October, the country initiated a follow-up plan called Post-COVID-19, or the New Normal, for 13 of the country's 15 provinces, Havana included, plus the Isle of Youth. Masks, hand washing, social distancing, all still mandated. Anyone with symptoms to stay away from work and report to a health center. To continue, daily active screening in the whole population to identify people with respiratory symptoms. Carry out PCRs on all such persons. And one hospital per province will still be equipped, especially for COVID-19 patients. But the schools are all expected to open by November 2nd. Airports to gradually open. Most are open now. We're still waiting for Havana's international flights. With mandatory PCRs for all passengers. And reopening houses of worship, theaters and beaches, restaurants and bars, but all with specific safety precautions and all in accordance with the epidemiological picture in each and every place. They're extending maternity leave to ensure 100% salaries of staff for staff if workplaces are closed during COVID-19. Looking forward then, the main challenges for Cuba are economic challenges because tourism, of course, was blindsided by the pandemic and will surely be slow to recover given the pandemic elsewhere. And of course, we still have the stiffened economic sanctions in place from this administration in Washington. Finally, lesson 10. Lesson 10 is basically this: we are all in this together. Global health cooperation is lesson number 10. We saw this cooperation first in Havana itself, when Cuba became a safe haven for the HMS Braemar, a British cruise ship with COVID-19 on board among its over 1,000 passengers. No other country offered a port with an opportunity to be repatriated by charter flights home. Then Cuban volunteers, over 3,000, were dispatched in 59 teams to 39 countries, including Italy, where Cristiano Ronaldo of Juventus became a fan, then throughout the Caribbean, Latin America, and elsewhere. All of these health professionals, a majority of them women, have risked their lives to save lives. So perhaps nothing says it better than they do, that we are indeed all in this together, and perhaps the most important lesson.
Excellent, Gail. Thank you so much. Caitlin, did you have something to add to that?
No, I'm just seeing some really excellent questions come through in the chat, and I was wondering if we could maybe address these.
Yes. So please start. For those that you can address.
I'm scrolling.
One of the first was a question about whether or not other diseases, particularly for chronically ill folks, have been maintained during the epidemic, or did the response interfere with the ability of Cuba's health system to provide its regular services?
Yes, I think I can answer that fundamentally, but it would have been great to have Cuban specialists on board here.
Mhm.
They have maintained the services that are essential to these patients, certainly dialysis, certainly cardiovascular, for cardiovascular patients as well. But there is no doubt that I think even, in Cuba's case, you have people wondering, well, I don't really have much wrong with me. Should I go to the doctor? I think you have sort of this, if you can say it this way, patient self-censorship when it comes to heading out to the doctor if you don't feel you have something that is really serious condition. So while they did maintain those kinds of services, I would think that patients kept from going there, and they certainly did. They did suspend they did suspend elective surgeries during this period.
Mhm. Very
The
good.
other thing to keep, oh,
Yeah,
sorry.
go ahead.
The other thing to keep in mind is that unlike elsewhere, the Cuban healthcare system was never overwhelmed. They never ran into an issue where they just didn't have enough hospital beds to take care of things that weren't COVID, which is what we saw happening in the US and elsewhere.
Exactly.
There's a question about the lockdown. Gail, you mentioned that Havana went into lockdown recently. What about at the beginning? How stringent was the lockdown and how long did it last?
Well, the measures were fairly stringent, but I wouldn't say that they ever went into complete lockdown. And this is the whole issue of everything being epidemiologically based, being geographically centered, so that uh, you might have a neighborhood going into quarantine, but not a whole town. You might have a whole town going into quarantine, but not a whole province. And you never had the whole place going into quarantine. It was very much determined by the incidence rate, by the reproductive rate, the viral reproduction rate, by how many new cases were appearing, whether or not they were able to trace those new cases so they knew where they were coming from. It was a set of 5 diagnostic epidemiological criteria that determined what stage a different geographical place, whether it was a neighborhood, a town, or a province, could be in at any given time. So that meant that people in one area, in one province, had a different set of restrictions than people in another province or area.
Mm-hmm. Very good. And how about testing? A few questions, wanting to know a little bit more precisely just how testing is carried out, how available it is, and how does that reflect on beliefs that the majority, if not all the cases have been identified?
Well, one of the things that was interesting to me in following this on television is that every morning until very recently, when I think they're going into new normal and they're thinking this is overload for people. Every single morning they would say, okay, here is this new case. Here is the contacts that were identified from this case. And so they would follow up on those contacts, and those contacts would go into isolation centers where they were automatically tested and had to remain for 14 days. I was just astounded by this because, I mean, it's strict public health. It's not rocket science, or maybe it is, we're discovering, but it was very thorough. It is very thorough. They're continuing to do this today. The testing is by PCR. They are using the rapid test, but not as a confirmatory. They're using PCR only to confirm. And those are available both at hospitals, and then now they're becoming available at the primary healthcare level as well.
Mm-hmm. All right. So to use the vernacular we've heard so often here, anyone who wants or needs a test can get it?
That's right. In fact, I think it's a measure of people's trust in the health system that they did this active screening where, as I mentioned, at a certain point, they were screening, going home to home, house to house, contacting more than 3 million people in a single day with this massive effort on the part of 35,000 doctors, nurses, and med students, maintaining their social distance from the front doors and all of this. But it was a massive effort. And I think it's a measure of the trust in the health system that people were willing to be tested. I mean, in Cuba's case, it's just the opposite. The testing was available at a certain point, but because they didn't have that many tests in the beginning, they wanted to test in the beginning the people who had some kind of symptoms, whether that was fever, respiratory symptoms, or the broader spectrum of symptoms that we later saw.
And in Cuba, the internet, I assume, is not used quite as much as TV is.
I'm not sure about that anymore. They have at least 2 different apps that they're using for COVID in particular. There's a dashboard, there's an app, there's a bunch of other stuff. And certainly for finding out where things are open, where they're not open, where the chicken is, where the vegetables are, there's Telegram, there's all kinds of apps that people are using. I think internet is growing very fast in Cuba. There are more, I believe there are almost more cell phones now than landlines. And so it's a very strong community right now in Cuba.
So the app will play a role then in tracing, testing, and isolating.
It would play a role mainly in public education and mainly in answering people's questions and also in advising them what the current situation was. Because if you have the family doctor and nurse literally next door coming to your door, that's another opportunity. And also obviously on television.
Yeah, very good. Any use of telehealth as we understand it here?
No. They don't have that capability. They don't have the bandwidth for that right now.
Yes, we have some questions about treatment protocol for the disease. I'm not sure we're qualified to answer that in any detail.
I don't.
No. Do you know where someone with that interest could go to find information about it?
Our April issue of MEDICC Review and also the July issue carried the April issue carried a roundtable with people from the specialists from the Pedro Curie Tropical Medicine Institute, and then we had some more available in the July issue of the journal.
A note caller.
I have Joe and Kamala call me all the time. Like everybody.
Well, there is a question about what MEDICC might be doing with a new, hopefully, Biden administration to try to change some of this government's approach to Cuba. But that's really a different subject for today. Truth be told, we'll be doing whatever we can think of to try to affect some reversals of the current government's strict approach to Cuba. Let's see. There are questions about remdesivir and dexamethasone. They are in use in Cuba,
yes.
I understand,
Yes.
right?
Yes.
Yes. And question, did the Trump administration's withholding of funding to PAHO have any impact on Cuba's response to COVID-19?
I think it's had an impact on all of Latin America's response to COVID-19. The article that just appeared in the New York Times yesterday on the Trump and Bolsonaro pact, basically. They're on the same wavelength. They have withheld funds, both governments, from PAHO. The United States has withheld $110 million. At one point, PAHO was not clear if they could pay their salaries. They have let people go into early retirement. They have certainly cut their programs in various countries. It has meant serious difficulties in confronting COVID. And of course, both Trump and Bolsonaro have had a hand in the Cuban physicians and other health professionals returning from service in places like Ecuador and Brazil. And this has meant a terrible, very traumatic time, especially for those communities in poor, indigenous, and disenfranchised areas that were being served primarily by Cuban doctors. In Brazil alone, that was 60 million people. And Trump, as we know, has also threatened countries that have Cuban health cooperation, threatened them with reducing their funding. So, and PAHO was threatened. It's very clear. PAHO was threatened, and then we also have this administration removing the United States from the World Health Organization, which luckily will not go into effect for a while. Hopefully that can be reversed.
Mm. So, and I think perhaps we could again call attention to the journals. We have some questions that are quite medical. What about COVID lung fibrosis and other things? And I think, we're not clinicians involved in this, but it might be worthwhile following the journal. It's online, open access. So go to mediccreview.org and follow it in the future. I think there's a chance, at least, that future editions of the journal will include some articles relating.
Oh, absolutely, absolutely.
So,
and we already are.
Yeah, so that's really the place for people to go who want to follow more closely what the clinical response has been in Cuba, I think. Let's see. Well, there are some questions about how Cuba could show us perhaps how we can establish models of healthcare based on socialized medicine in countries that have capitalistic forms of government.
Let's put that in Europe.
Yes. Well, yes. The answer is, could Cuba show us? Yes, Cuba could show us if we were willing to listen. And actually, if you go through the journal and search the literature, there are a number of places where people have talked about how to apply lessons from Cuba to other socioeconomic settings to try to improve access to healthcare and healthcare outcomes.
And it's certainly a very strong argument for a single payer system.
Yes. Oh, yes, absolutely. Let me see here. Something about, Gil or Caitlin, whether the food supply or food access in Cuba has been affected by the pandemic? It's certainly been affected by the embargo.
Yes, it has been, absolutely. Anytime you restrict transportation, you're affecting the food supply. So some of the food supply in Havana, for example, was affected when they had to restrict transportation from sort of bread baskets surrounding areas that provide most of the fruits and vegetables. Also, I don't think that the effects of the US sanctions can be underestimated. It is just phenomenal. This Trump administration has attempted to block oil shipments from any country, not just Venezuela, from reaching Cuba, to really restrict to zero practically family remittances. We just saw yesterday that all of the Western Union offices in Cuba had to be shut down because of the new sanctions that the Trump administration has placed on Cuba. It is really a phenomenally outrageous. I don't even have any words for it anymore. It is clearly directed at people, at Cuban people, and it is just unconscionable. And so, yes, they have been affected.
Yeah, some have been applying the word genocide to this.
Absolutely.
There are several questions about why the Cubans can't get onto Zoom. Can you answer that?
It's the U.S. sanctions. Finally, they got out of, Google jail or whatever it is that you get put into here. They finally, I believe Google has now allowed them in. The Google Meet finally, I think we can do, but Zoom has not. It's a little bit like Amazon. You used to be able to buy from Amazon in Cuba as long as it was delivered in the US. And on the day that Obama and Raul Castro opened the diplomatic relations at that high level again, Amazon discovered the embargo and you couldn't do it anymore. So a lot of these companies, I think that Zoom would be completely covered by the Freedom of Information Act, but they don't know that, and they're very nervous about an administration that seems bent upon tightening the screws further and further. So nobody really wants to take the chance. And I think this also happens, by the way, with biotech investment in some of the Cuban drugs and medications that have been proven successful. But in the US, they're just very nervous about things that only happen through executive order and not a congressional determination to lift the embargo.
Right. Well, back to the pandemic, we have a question about where the first case appeared. Where did it start?
It started with
who's been impacted most? Is it mostly in the elderly that have, as it is in most other places?
Yeah, the first cases were among 3 Italian tourists. While it's true that more cases have been detected in older people, more recently, that age has been going down to below 60 now. In terms of majority of cases. So they're seeing a shift from the older population to a much younger population, I think reflecting the fact that who's partying? I don't know how else to say it, but it's a serious problem the world over, I think.
Mm-hmm. And you mentioned the movement of medical students into the field to help combat the pandemic. So someone is wondering then, what impact does that sort of action have on the education process itself?
I think it's a phenomenal part of the education. I think it's a great part of the education. They're getting in the field experience, which has always been the strong suit, I think, of Cuban medical education, that it's not just classroom based. And so this will be turned into a learning opportunity. I have no doubt about that. And if they have to extend the school year, they will. Classes as such are just now beginning again. So I think the medical schools will be in the same kind of academic year as the rest of the universities. So they will have their academic year, and I think they will be more informed when they do go back into the classroom.
Yeah. You mentioned that Cuba's sending health professionals abroad. There's a question about whether there's been much coordination with countries that have been similarly successful in dealing with this pandemic, countries like Vietnam, perhaps, or some of the other Asian countries. Do you know whether there's been much back and forth between Cuba and those places, or has Cuba pretty much developed this on its own?
I think that's a great question. I know that they have been learning daily and almost hourly from everything that's coming in. Luckily, we have a situation in which most all of the major journals that are reporting on not just the epidemiology, but the clinical trials and all kinds of issues regarding COVID-19, routes of transmission, et cetera, are making that content open access, freely available online. So I know that kind of information is flowing into Cuba and they're making use of it. If you listen to the daily press briefings, you would be astounded at where they pull data from. But I think the question is more directed at the active collaboration with researchers in various countries. And that's a good question. I don't have the answer to that. I would imagine that the communication with Vietnam is quite fluid, but I can't say that for sure.
Mm-hmm. Well, one person on the call here has noted that Cuba and Ohio the state of Ohio have about the same population. And the question is, could we contrast the approaches, their successes and problems? I think maybe the whole question and answer period begins to address this, because most of us, I think, are aware of how inadequate the US response has been, where Cuba has used a direct public health-based scientific epidemiological approach. And in the US, we have done very little of that, and have been in many ways so overwhelmed now with infections that even thinking about effective contact tracing and isolation is almost impossible. So, Ohio is just an example of most states in the US that have not been able to handle this nearly as well, as the data clearly shows. There are some questions about how medical education occurs in Cuba. Certainly we could refer people to our journal. We've covered that in previous years fairly well, I think. And of course, there are a variety of other publications and books that focus on medical education in Cuba. We certainly don't have time to get into the details of that. Let's see, I think I'm looking here. There's a question about impacts of the pandemic on mental health in the US. Do you have any information about that in terms of the Cuban experience?
I'm not sure what the question is.
Well, I suppose it's related to pandemic fatigue, depression, certainly the lockdowns, the loss of jobs, the uncertainties, the personal impacts on people who are ill, impacts on the family of people who are ill and die. There's a lot of concern in the US now about the mental health residue associated with this pandemic.
Yeah, there is in Cuba too. I wasn't sure what they were asking. I know that there is in Cuba, very early they had the Association of Psychologists put together, again, an app for people looking for reinforcement on how to maintain their mental health during the pandemic. And then more recently, they have set up specialized psychological services for people. I think they're still dealing with this, and I think it's a major focus right now because of, as you said, all of the above. Especially in the Cuban context, also just not knowing where things are headed. Well, we don't know quite here in the United States either, but I think that's a very vital concern. And whether or not there are lessons for other countries, I think we'll have to wait a bit and see.
Yeah. All right. There's been a lot of chat about some people who've been to Cuba with MEDICC trips, recommending that others go. Thank you for that plug. We hope when travel begins again that we can accommodate those desires. Let's see, the question about where do things stand with the collaboration with the US for the programs that started under Obama. Is any of that still active?
Not much. The collaboration that is most active probably is the clinical trials for the Simovac lung cancer vaccine by Roswell Park Comprehensive Cancer Center in Buffalo, New York. Many other things have just ground to a halt under the actual current administration. And I think MEDICC itself we may have to dust off our white paper that we presented to President Obama, and under which we advocated a number of things which were adopted by that administration, including, interestingly enough, joint research, joint medical and public health research.
Question about what the homeless situation is like in Cuba, and whether, what is the homeless situation and what's the impact of COVID related to that?
I would say there's very little actual homelessness, especially when you compare it with someplace like the United States. It's not that there is no homelessness, but there is a greater tendency for people to live in multi-generational households. There are obviously some nursing homes and so on, but it's more culturally common for people to live in those multi-generational households, and you don't see that many older folks living alone, much less homeless. However, during COVID-19, that presents a whole nother issue, which I made some reference to in terms of their decision to hospitalize all patients with COVID, which I think saved a lot of older people in particular from contracting the virus, because it's one thing if you just live together with younger people perhaps and they contract the virus, and it's not that they're not in danger, but perhaps less in danger than a vulnerable group like older folks. Interestingly enough, I think the other group that's been particularly affected are those that have had some relationship to the tourism sector because of travel back and forth. A lot of the eastern provinces just have not had cases for several months now.
Yeah. Do you have any idea of whether other countries have come to Cuba to learn, or have connected with Cuba to learn about their response to COVID, particularly in terms of designing their own? Is there any information about that?
There's nothing, I haven't seen anything. One of the things that I think that MEDICC can and should consider is for the fall of 2021, perhaps organizing, hopefully we will be at the point where we can do so, trips to Cuba for health professionals from the US, whether it's a group of virologists and immunologists or a group of public health professionals, to look at the Cuban strategies, look at the Cuban vaccines and pharma in these different areas of interest, and also to exchange about what they're doing. It's not that there aren't positive experiences in the United States, despite all of our issues and problems. I think that, especially locally, I think there must be experiences to learn from.
Oh, yes. And my prediction is that we'll have a fair number of requests from folks who will want to better understand just how Cuba dealt with this issue. Well, I'm sorry to say we're essentially at the end of our hour, so I'm going to have to close us down shortly. Certainly, as we've already said, if you want to know more about MEDICC itself, then please visit our website at medic.org. You'll find a page there dealing with travel to Cuba, as well as a button that will get you to MEDICC Review, the journal. Encourage any of you who are not familiar with the journal to take a look at it. It's quite searchable. There's more than a decade of issues there, covering a whole variety of subjects related to the Cuban health system. And certainly if you want to continue to track what comes out in the formal literature about Cuba's response, MEDICC Review is one place to go to do that. I know that there have been questions about the session being recorded. It is being recorded. It will be made available to folks. I don't think there are any questions we've missed, but if there are, we'll go through and try to get an answer out to folks, at least as best we can.
Right, and someone asked if it would be made available, the recording of this, and we're going to be putting it on the MEDICC Review and the MEDICC websites, both.
Good, all right, so that's your answer. So with that, I'm afraid we need to close. Let me thank everyone for your participation. It's wonderful to have so many people interested. We're delighted you were with us. Our thanks to Caitlin and Gail for bringing us up to date with what's going on in Cuba. And please stay in touch. And as we get into the giving season, you know, we are a not-for-profit corporation.
That's
Always,
certainly true.
always, yes, always looking for support, especially during this time, this difficult time, as everyone says, and especially given that we try to do this work with a country that is really treated so badly by our own government at this point, makes it difficult to find support for our work. So please consider making a charitable gift to MEDICC before the end of the year. And with that, again, I thank you all. Thanks to the speakers and the participants. Elizabeth, thank you for making this go smoothly. And
Good luck,
best wishes for
Ohio.
the rest of the day. Hey, hi there. Nice to see you. All right.